Yeah, okay. So,
Okay, let's begin again.
hello everyone. I welcome you all to today's session. So, today we are going to start with a very new thing. First of all, this is something that we have planned for long. So, this is the beginning of Psych Reads SS. What we are going to do is today we are going to introduce you with one of the aspect of Psych Reads SS, that is child and adolescent psychiatry. And for doing so, I invite Dr. Jayashree. She has completed her MD Psychiatry from AIIMS Kalyani in the recent DM entrance exam, which was held in the month of May, and the result came in month of June 2026. She secured a rank of 4, and she was able to score a pretty good marks. She is knowing what are the do's and don'ts for the exams, and also she'll be highlighting you all the important aspects, not only the important aspects, the important topics, and from where to carry out the preparation. So with this, I hand over now to Dr. Jayashree so that you can start. Yes.
Jayashree, you can start.
Yes, sir. Hello, everyone. I hope I'm audible to everyone. So, hi, I am Jayashree. So, as I said, I did my MD from AIIMS Kalyani, and currently I'm pursuing my SRship from AIIMS Guwahati. And yes, I did secure a rank of 4. And this was something that I was there in my head also. Like, I was really looking forward to something, and I was so glad that this thing happened. So today I will actually like to, make everyone go through this whole thing, how the thing actually is, the DM exam, the important topics, and the weightage that is given to each topic, and how to go about it. So that is the introduction section that is going to happen today. So I think we should move ahead.
Okay, fine.
So yes, see, I think the number of people that apply in INISS in child, for that matter in psychiatry, are quite less compared to other branches because it's still in the growing phase. So first thing I would like to tell everyone is you never know what you can do until you try, and very few try until they have to. So I think it's time that we all start trying and go for this further thing in INISS in psychiatry as well. So that's what it was about. Okay, so let's come to the pattern, okay, how the exam is. So there are 80 questions in total, out of which 50 questions, like from the first question to 50, they are directly from child psychiatry. So while I was actually answering the questions, just from the first question to 50, it was only about child psychiatry. And from the 51 question only, the general psychiatry started coming. And from the general psychiatry, there is a lot of weightage on addiction psychiatry also. So there were like 6-7 questions from addiction. There were some from core general psychiatry also. And there were some statistics questions also in that. So in all, there were like 80 questions. Apart from there is +1 mark for every correct question. And there is -1.3 for the wrong questions. So in this exam, I had a score of 57.33. Okay, so I think this is one place where we all keep on hopping a lot. We just go from one resource to other, and we spend a lot of time thinking in where to read things from. So I thought the first thing that we should keep in our head is that we need to keep it really simple. So most of the things in child psychiatry has been covered very well in synopsis. So all the child psychiatry chapters, if we go through it, most of the questions can be answered. And mostly the child psychiatry section, each chapter is actually very important there. And apart from it, I think I used Tasman for the human development chapters. So it really covers the development part from infant till adolescent, adult, and old age. And in synopsis, in the last part of synopsis, you'll get a basic sciences part. So from there, a lot of questions are framed. So in total, if you do all of these two books itself, you can easily score 50, above 50, even above 60. So first, try to get a hand over these two books at least, and then we can look for other resources. So the highest number of questions that actually comes from is human development. So last year, there were 6 questions from Piaget's developmental stages. This year, there were 2 questions from Piaget's, and there were 2 questions from Bonfen-Brenner. Okay, so it's like an ecological theory where they are talking about different stages, and we will deal with it in the coming classes. And apart from it, Ericksonian psychosocial stages also have around 3-4 questions every year. Freud has been there, Vygotsky. The attachment theory, they ask a lot about the stages and which stage will it happen and in which stage is attachment the strongest, in which age it happens. And in Margaret Mahler's, they also ask the age group. So I would like to really emphasize it here itself that in INISS, for any subspecialty, there is a lot of weightage on numbers and percentages. So they will ask you like which is the age group. They will ask you what is the percentage. They will ask you what is the concordance rate. So anything which is very numerical automatically becomes very important for child psychiatry. That I can really clarify now itself. And yes, the physical development, there was a question on tenure staging. So every year there is one question on physical development, which is mostly the tenure staging, be it the male stages or the female stages. And they will mostly give you the stages 2 and 3 only because that is related. So when we are actually going through this course, we will focus on things that are most important. We're not going to get everything on our head and then forget everything. So yes, and there are some image-based questions also. So there will be some test, like there is an A not B error. Okay, so they'll give you the image and they will ask you what is this test. Or there will be some test of egocentrism and they will ask you in which stage this test actually happens. So like this, we have to go through the development part. Okay, next. Okay, so there are a lot of questions on developmental milestones as well. So they will ask you in which age this milestone is achieved. So last year there was a question where they asked a 2-year-old, okay, so you can remember it like 24-month-old. So how many words can they speak? So the answer was 240 words. So this kind of questions are being asked in developmental milestones. So they will like to ask you about the number of words spoken or which milestone is achieved at what age. So again, the same thing comes here that the numbers are very important. So coming next is nosology, right? So in nosology, this time there were 5 questions almost. And last year, my seniors told me that there were 4 to 5. So approximately there are always 4 to 5 questions. So there they ask you specifically about the differences, that if it is ICD-11 saying this, what does DSM-5 say? And what is the recent changes in the ICD sections that has actually come across? So in nosology, they will ask you this only. And a lot of times we are focusing on the core criteria, but we forget the specifiers, right? So they ask you whether this is in DSM or this specifier is in ICD-11. So likewise, you have to remember in nosology about the specifiers, the differences and recent changes. We will deal with it further. Okay, now image-based psychology instruments. So a lot of questions are being asked on the Rorschach test is there. I think last year there was a question where they asked about that at what age you can start applying the Rorschach test. So such kind of questions are very commonly asked, and even the child perception test questions have been there in the past. So these will kind of questions will be there, and they will give you some images also. So this can be specifically to child-based, like child perception test or draw a person test, or it can be something which is general, like Rorschach-based questions or TAT questions will be there. But they are mostly easy and doable if you read. Okay. Let's move on to the rating scales. So every year there are 3 to 4 questions on rating scales. See, the most commonly last year question which I got was, they have asked which of the following is a parent-rated scale, or the question is something like which of the following is just a self-rated scale. And they will give you 4 options. They will ask you which of the following is a diagnostic instrument, or like which is a rating scale. So they will mostly ask you the difference between the scales. They will ask you to pick up which is both parent and self-rated, or which is only parent rated, or which is both rated. So they will give you options. So last year there was a question. The question was, what is the age group in which we can apply MCHAT? Okay, so this was the question last year. This time there was a question where they have asked that which of the following is a diagnostic instrument out of all the options. So likewise, we will obviously discuss it when the classes follow. But the purpose of telling you the things here is that I want you to know where to put more attention and focus when you're studying. So you don't put everything again. So ISA is a very common topic. So last time the question was which is not a component of ISA, right? So this was again last year's question. And the SCARD. So the question from SCARD was that SCARD is a rating scale for anxiety. Okay. So in SCARD, what happens is they will ask you which is not, the question was last year, the question was that which of the following is not a anxiety disorder, which is a part of SCARD. So likewise, there are different anxiety disorders that we screen, but they will ask you which is not a part of SCARD. So like this, we'll discuss this in the classes, but this is for now. Okay. Next slide. Okay, so let's come to the core topics. Okay, so what are the core topics we have is the child psychopharmacology. So I think I actually counted the number of questions from here. This year it was 6, last year it was 17 questions from child psychopharmacology. So it was so many questions that were there. The first question I remember was about methylphenidate. So they have actually asked, which is the trial, okay, in which, in the PTA trial, I think which molecule was used. That was one question. There was another question on methylphenidate where they have asked is what is the onset of action and the duration of action of methylphenidate, immediate release and extended release respectively. So again, as I have told, that there is a lot of focus on numbers. So even if it is a duration of action, it is an onset of action, it is again number, right? 15 minutes or we say 2 to 4 hours for immediate release. So anywhere where it is numbers, it becomes important for child psychiatry DM exams. Again, for atomoxetine, they have asked the half-life of atomoxetine. Again, there have been a question in comorbidities. So if a child presents with tics and at the same time they also have ADHD, which will be the molecule that we will go for? So that the answer is not methylphenidate, it is clonidine, right? So these are kind of questions which they ask very commonly, that which molecule has to be preferred in comorbid conditions. Likewise, they have asked again about the differences in metabolism. So see, in child and adults, there's a lot of difference in bioavailability, right? So they will ask you what is that difference in this, and this becomes important for this lithium and other drugs. So there was also a question in lamotrigine last time, then what is the percentage of rash with lamotrigine in children? So such kind of, again, percentage is a number, right? So again, that thing which is a number, again, was important, and that was a question. So this is the antipsychotic induced weight gain. So that was a question. What do you define as antipsychotic induced weight gain? Wait, the question was what is significant weight gain and in children. So likewise, they have given, and again, there were a lot of FDA approved questions, like which of the antidepressants have been approved in under 12 years, and one question was under 8 years in MDD in children. And so mostly, when I actually counted all the questions separately, there were nearly around 15 to 17 questions from this topic itself. So we will really be more focused on this. Next slide. Again, in therapy, okay, so last time they have asked about a question on play therapy. So who has actually given the play therapy was the question. Then they give a lot of named therapies. So there was a question in which they gave an image of a cat and they asked like, which is this used for? So that is the coping cat mostly, and that is used for this anxiety disorders in children. So likewise, they will give you images sometimes and they will ask you the therapy. And then they will ask you the principles of CBT. And there was a question on trauma-focused CBT also. So there is a practice, like a mnemonic is there, which is there for PTSD in children. So you have to remember which is not a component of this practice. So likewise, they have a lot of therapy questions, but they are like 3 to 4. Again, we are coming to trials. So in the past, they have asked about the PTA trial, they have asked about tags, and they have asked about, basically they ask about the molecule, like in this trial, which molecule was being used. So if you remember which arm were there, what were the drugs in each arm, and so that itself is enough to answer this trial questions. Like they are simple, they are not a lot difficult. So you just have to remember that which molecule was used in which trial. So they will give you like options. So which of the following was not used in this trial? Suppose in star D, no, star AD, which was not used for adolescent depression. So you have to know that this was not a part. So the exception you have to remember for such trials, but you don't have to remember all the results. That becomes quite cumbersome. But if you remember the drug also, that's enough to answer. Okay, so child psychiatry proper will come to autism. Okay, so autism spectrum disorder had nearly 7-8 questions this year, and last year my senior said it was around 10 to 12. So the first question I remember here was about nosology. So they have asked a difference in nosology in autism between the DSM and ICD. The second question they have asked in autism was about the red flag signs. So they ask you which of the following is the earliest red flag sign that you will see. And apart from it, the medications are there. There are phenotypes that they are asking very commonly. And there was a question in autism also where they have asked that how many percentage of children with autism spectrum disorder eventually move out of the spectrum. So they have given percentages of that. So this was a few questions which I can tell you now, and rest will be discussed. And in IDD, a lot of syndromes are being used. Okay, so there is a page in synopsis also. So there's a chart where they have discussed all the syndromes in IDD. So they will ask you which is the feature of this, what is the percentage of children who have this condition, and how many people with Fragile X syndrome have autism, how many people with Rett syndrome have autism, or how many people with this one tuberous sclerosis develop seizures. So again, these are percentage based questions, and they are related to autism and IDD. So whenever the syndromal thing comes, they ask a lot of questions from these two topics. And then coming to ADHD, so in ADHD also they have given a nosology question this time, and they have given a lot of pharmacology on ADHD. So this methylphenidate, these trials were very repeatedly asked in even last year, and this year there were questions on it. In ADHD, they will give you 6 to 7 questions. Then coming to specific learning disability. So the first question they gave was about the neurobiology of SLD. So in neurobiology, they have asked specifically that which is the problem that is seen mostly in these people. So the answer was deficits in working memory. So likewise, you have to remember that in the neurobiology, why are they not able to function? Why are they not able to remember the letters, how to write them? That is because they're not able to retain what they have just learned and use it. So that is one thing was the answer that I remember of this. In school refusal, they mostly ask about the classifications, whatever is there, and they will give you case-based questions on it. For communication disorders, they have mostly asked last year about stuttering, and they have also asked about the social pragmatic disorder. And there was one question which they have asked about the last eight. Okay, there was a question which said that, but in which of the conditions is the last eight or late eight seen? So that is like in communication disorders, may you see that is the speech sound disorder because they develop late. So such kind of questions are asked. So communication disorder is something in which very superficial questions are actually asked. They are really not difficult. If you have read it even once from synopsis, you can answer these questions well. Okay, so childhood depression. So this chapters, no, childhood depressive disorders, mood disorders, suicide, psychosis, substance use, and eating disorders. So out of this, I would rate the eating disorder is most important because it is very much common in adolescents. In my exam, this time there were 3 to 4 questions on eating disorder itself. So they have asked which is not a feature of refeeding syndrome. So there was this all hypo, and hyper. So the wrong answer was hypermagnesemia. So likewise, they asked about it. Then they asked about which is the most common eating disorder in India. Then there was a question on a case-based thing, and we had to identify whether it belongs to. Well, they asked the diagnostic criteria kind of thinking, which is the diagnosis for this case. So likewise, you have to remember for these questions. And for psychosis, they have asked questions like what is the age, what is very early onset, and these questions were there. Substance use, they have asked about the global youth tobacco survey. So there was a question in which they asked which is the false option out of all the options that were given there. So from substance use also, they have given this survey only questions in adolescence. It was there. And yes, so in suicide, the most common thing that they ask is about the management, the high risk protocols. These questions are very much there in suicide about how will you proceed, what is the first step that has to be done, and what is the percentage of patients who have committed suicide who have visited a general physician in the last week. So that was a question. So such kind of percentage based questions are also asked in child psychiatry about suicide in adolescents. Okay, so genetics. So genetics is actually very important because there are like 8, 9 questions which are straight from genetics. So in my paper, there was a question was what is the concordance rate, twin concordance rate for monozygotes in conduct disorder. So this was a question this time. So likewise, they have also given some images of this mucopolysaccharidosis or this genetic condition in which this like this there is ID and there are some specific phenotype in the patient, and so you have to identify whether it is Hurler or Hunter's disease or whether it is like I think one question was on this also. This one, cysteine beta synthase deficiency is there, and homocystinuria. So there was one question on that also. So all of these conditions which actually have mental retardation in common is being asked as a part of genetics. And then they will ask you about this epigenetics. 1 or 2 questions will be there. Mostly the syndromes will come from genetics. So you have to be able to answer the, I think there was a question on the patterns also, like autosomal recessive or whether it is X-linked recessive. So these questions are asked, okay. And the neuroimaging, this time there was, I think in neuroimaging, I cannot recall, but there is one question on neuroimaging, which I have seen. And forensic may, there were a lot of questions. And these questions are mostly all case-based. So we were asked like if there's a child who has committed this crime under JJ Act, so what will be the outcome? Or or I think there was a question on conduct disorder also. So they have asked that, we have used risperidone, we have done everything. So what is the next step that can be done for this child? So such kind of questions were there. There was a question on POXO. There was a question on MHCA for children, section 87. And these are all case-based kind of questions. And these four topics, POXO, JJA, MHCA, 87 section, they come every year. So there will be one question from this topic every year. It can be more, but not less. So this comes to 4 to 5 questions every year in the topic. We're done. Next slide. Okay, so EEG, I think they have given a question on, they will give you the image of an EEG. So from that image, you have to identify whether it's the EEG of a patient with absence seizure or the most common ones I'm saying, because it will be one of them only. So first, either it will be absence seizures, or it is going to be a normal artifact, or it is going to be something like GTCS. So these are the three things that have been coming every year. Sometimes it is one EEG they are giving, sometimes it is two, but almost one is there every year from EEG. I think this year there was not one, but last year there were three from EEG itself. And coming to child neurology section, so there are questions in the neurology section from epilepsy a lot of times. Like they will ask you the syndromes, they will ask you the percentage of ADHD and epilepsy, or they will ask you the percentage of pseudo seizures with seizures and seizures with pseudo seizures, and the most common personality disorder, or such kind of questions are very commonly asked. Or they will also give you the cases that this has presented with this, whether it is interictal psychosis or postictal or preictal psychosis. So this kind of questions will be there from epilepsy. And the syndromes they can ask. Okay, sometimes they have asked about one or two syndromes also of epilepsy. And then about this, we have read about the palsy also. Cerebral palsy they have asked once. It didn't come this year, but I think last year there was one question on cerebral palsy that they have asked in the neurology section mostly. So I have read this during my time, but I think one question we can expect. So this will be something that we can make it correct in the exam, because it's very easy if we have read it. Now from miscellaneous books written in child psychiatry. So there's always one question which is there on the books. So last year there was a question on who is the author of the book. I remember is this one, Deviant Child Grown Up. So we will be discussing about all the books which actually are being asked in child psychiatry. So that book was Lee Roberts. And this year there was a question on tabula rasa. So they have asked that who has given this whole concept. So that was John Locke. So kind of one person and one concept and one book will come in every exam. So like important dates are there. So what are the important dates they have asked is the World Autism Day, the POXO, the day in which it began. So such kind of questions will be there from the dates. So then again, once they have asked the child line number, so we'll discuss when we go on with the classes in this. And Indian and foreign follow-up studies. So there are some studies which will come. Like one question comes from follow-up studies, whether it's a Indian study or a follow-up study, but there is one question generally. Last year, I have been told about the this course and outcome of bipolar disorder in young study was there, and there was an Isle of Wight study which had come previously, and Romanian adoptee study. So we will discuss each of the studies and what all we need to know from the studies. We are not going to read the entire study, but what is asked, only that we will discuss. Again, there is this epidemiological studies. Will also be covered, and in community psychiatry. Mostly in the community psychiatry also they are dealing with this follow-up studies, like what was the OCD follow-up study done and what was the results found, what was the difference in this, like there was a study which was done in mood disorder in children versus in adults. So the follow-up differences, what happened in this, how they actually presented. So there were some studies which were done on that. So in community psychiatry, we will deal with it by the end. Okay, so that's all I think that we are here. So,
Okay. So, Jayashree, I let audience to ask some few questions regarding the exam if they have. One question I have for you, whether the majority of question is factual based or clinical case scenario based?
yes, ma'am. Ma'am, actually, initially, I think this time I can tell you, like, there were a lot of factual questions. Like, there were around, out of 50, there were 35 factual questions. And these factual questions were mostly numbers. Like, what is
Okay.
this? What is the rate? What is the concordance rate? Or this kind of questions were there. And a lot of them were like about this thing also. Nosology-based questions were there. Not, I'm not
Okay.
55, but 30. 30 were factual and 20, I can say, were clinical case based. The forensic psychiatry part, and there was this a
Okay.
young, so ma'am, like this. There were.
And psychopharmacology cases?
Ma'am, psychopharmacology in my paper this time, it was like 7 questions. Mostly the questions were about the drug that we will use, or like there was a question. The answer was risperidone, which is approved for. I think the question was if there's irritability in autism, which one will be used, and the answer was risperidone. And then there were questions on methylphenidate and
Okay.
atomoxetine, so clonidine. So such kind of questions were there.
Any recent update? Question
Ma'am,
on recent updates?
Ma'am, recent update question was there from the general psychiatry part. So they have asked that in December 2025, there was this TDCS which was approved and home-based TDCS was used,
Home-based, yes.
approved in December 2025. So
Yeah.
for which of the condition was it approved? So that was the question in the paper this time. So there is one question, but that is overall from recent update. So that,
Okay. So now I ask audience to ask any doubts from Dr. Jayashree regarding the exam or
So, like,
regarding
yes.
preparation also.
Like she has given a very comprehensive and also have included a lot of details regarding what all topics needs to be studied. Also, not only that, she has given the resources also. Now I ask you all if you have any doubts. Okay, one of the question that was asked by Raghav, such a session will be held for de-addiction. We'll definitely plan that
Yeah,
for
this is
de-addiction.
just a teaser, guys. Trailer अभी बाकी है.
Now this,
So our course will enclose 3-4 component. One is child and adolescent psychiatry, definitely. Then addiction. Then psychosomatic medicine, definitely. DM seat was available in AIMS New Delhi for psychosomatic medicine. Okay. And then geriatric psychiatry also. So we will cover all of that. This is just a teaser. So first we are covering each by each. Then after 2 weeks we are planning a comprehensive session in which we invite people for doing DM in that specialty.
And
Okay,
she
and we
also
will guide.
mentioned, and Jayashree, you have also mentioned that addiction was also a part which came in child psychiatry.
Child also.
Yes.
Mm.
So a kind of you need to know everything, but specific focus on child is required, but the base should be strong, isn't it?
Yes, sir.
Anything you guys want to inquire?
Okay.
Vyas.
Is there any MCQ practice bank that we can use? This is asked by Dr. Bhavya. This is the question which is asked by Dr. Bhavya.
So I guess currently there is no question back available, but we are working on it. So by end of this month, we are releasing our course in which we have a specific Q bank based on the previous year questions and the pattern that are followed in our entrance exam, right, Jayashree?
Yes, ma'am. Yes, ma'am.
We are collecting PYQs from different institutes and the repeated topics that are come. So basically, the problem isn't the effort. Is usually there is too much information and we don't know how to prepare it. Okay, child psychiatry itself is very extensive topic. There are so many topics: forensic, core psychiatry, psychopharmacology, community, addiction. So we need clarity, the pattern that follow in the MCQs. Okay, so you need guidance for that. Definitely, we have like people like Jayashree to guide you with that. Okay, she has prepared all this, and we are working on the Q bank specially because there is no Q bank available right now. Next slide.
Yeah.
So we are planning that whatever material we are giving, that will be comprehensive only for the MCQ exam. Okay, and definitely there will be one-to-one mentorship will be there, and everything, even a single line we are providing. Like Jayashree said, there are many factual questions in the exam, right, Jayashree? So
Yes,
we
ma'am.
will provide reference to each factual question and answer, definitely, because that is the matter. Okay, so that's why Psych Reads is planning Psych Read SS program in which not only child psychiatry will be there, addiction, geriatric psychiatry, and definitely psychosomatic will be there. Okay.
See, it's a complete basket, but remember that child and adolescent psychiatry is what we are starting with, and it and has been mentioned by Jayashree that it also includes other important components.
Yeah.
So please remember that you need to keep a check of all the basic topics, and on top of that, what she has mentioned in this session, all of you should be looking forward for those topics.
We
Isn't
will
it?
share this PPT in the group also, so
Yeah,
that will help you
yes,
guys.
it will be available in the app. You can download it. Okay.
Okay. And definitely, Vishwa, this program will be launched in the last week of July. Enrollment will begin, and we will only taking selected residents in that. Okay, yeah, definitely some component of general psychiatry that are coming repeatedly in the exam,
No, no.
whether it is DM addiction, whether it is DM child psychiatry and geriatric, all that component of core psychiatry and the basic neurosciences, biostatistics, all will be covered. We will not spare a single topic. That's why right now we are going through the PYQ from different institutes to curate that topic list. Okay. Uh, Jayashree, anything you want to say?
Yes. Any last important thing?
Yeah, guys, you want to ask anything from Jayashree?
Like what were her preparation? How did she manage along with her senior residency, and what were the important hurdles that she passed on? What was those things? If you want to ask, she's right in front of you.
Dr. Vishwas.
Okay. Okay. Yes, we do have question. Any time management needed during exam? This is the question that has been asked. Any time management needed during exam?
So I think we get around 180 minutes, okay, which is 1 hour, like 1.5 hours. So I completed the paper in 1 hour only. So the last half an hour I actually only spent reading and revising the paper. So mostly the time gets managed because the questions are fact based. So if you know, you can just answer them directly. And I would say that a lot of people are going to tell you that you should answer the whole paper because it's only 1/3 negative, but you should not, because it's like this 0.33 no that matters here a lot. Like I answered like 76 questions out of 80, and this last 3 4 questions I attempted in the last moment, and I shouldn't have actually, I feel. So whatever you feel in your sound mind when you have done everything, don't change answers, because the last moment changes that you do are actually not really good. So the thing that comes to your head first, mark that answer and leave that question as it is. Don't go back and keep changing answers in the last moment, and that is really not something fruitful that I will advise. And don't try to attempt everything, because negatives do count. The ranks actually matter in point 0.3 marks also. Like they will be like one rank will differ from the other by just point 0.3. So I will always tell that it's safe to attempt only the questions you know, and also when you are like having a confusion with two options, do attempt it, but don't mark option like out of pure guesses. That is not going to help. So like any healthy number I will say is above 70 you should attempt. Between 72 to 780, if you're confident, do attempt, but don't attempt because you feel that it's 1/3 only that is going to get deducted. That's not the thing. It really matters in this exam. It's just this point 0.3 marks that matter at the end. So don't do it, and don't change answers in the last moment. What
Okay,
you have
Vivek. Jayashree, Vivek is asking that how to proceed with the biostats part.
Ma'am, biostats part, I will say that the 4 questions I actually left were biostats, because they have actually asked questions from the qualitative studies, the differences. Like there was an answer on chi-square. There was one answer which was on repeated measures ANOVA. There was one answer which was on this one, qualitative and quantitative, both they are asking. Or they were also asking about this question was on confidence interval, on meta-analysis. So it is mostly the basic that we study. Like that, I actually read the Psych Reads notes only for statistics that ma'am and sir have taught. So I revised those questions only before the exam, and I did like there were I think 13 questions on statistics nearly. So I could answer like 7, 8 out of them, 8 to 10, and rest I left because I had no idea. So I
So
don't
there
remember.
is a huge chunk question on the biostats. So
Yes.
definitely we will put lectures in which we are covering the important aspects of biostat. Definitely 13 question is too much in 8 out of 80. So definitely biostats is important aspect in any DM entrance exam, whether it is a de-addiction, child, and even for the PDF exam. Psychiatry resident asked whether the recent update will be covered in the app. Definitely, we have two booklets and there will be live session for recent update also in different aspects, especially child, adolescent, de-addiction, and general psychiatry. Okay.
Okay, Bhavya has asked this question. Why did you choose to go with CAP?
Hmm.
Oh,
Hmm.
okay. So that is something I'm still thinking. I'm still thinking, like, I think I also don't know. It was like I liked it, so I thought that let's go for it. And
Hmm.
because yeah, it was just like that. There was nothing specific. I actually like every subspecialty, so it was like let's go for it this time. So I just went like that.
Yes, so basically you are saying that you don't have to wait for the perfect time to launch the bullet. Otherwise, you will be the person who will not be using the bullet and will be dead. So basically, you should do it when it comes to you. Okay, fine. Any idea about seat matrix? I'll just share that slide with you. Okay, this is not in this slide. It is there in other slide. I'll just share it with you regarding the seat
Hmm.
matrix. Yeah, that's a very important topic. Thank you for asking this question. Yeah, it's there. Just a moment. Yeah, regarding the seat matrix, we have added this part over here.
Yeah.
Yes, this is the seat matrix, and just a minute. Yeah, this is what it is over here. Yes, Jayashree, can you just, yeah, this is what it is. Yes. Hmm.
A screen is visible.
Is the screen visible? Not visible.
No, sir.
Okay, I'll do it again. Not a big deal. Yeah, fine. This is the seat matrix one. I hope now it is visible, isn't it? Is the screen visible regarding seat matrix?
Yes, sir. It is visible.
So this is the seat matrix. Okay. So you can see
So,
that. Yeah,
hmm.
yes, please proceed.
So
Yes.
So let me explain this to you. So first, I have put in the seat matrix for the last year. So as you can see, there were a total of 4 seats. So two seats for in the UR category. So two seats are given in NIMHANS and two in PGI Chandigarh. Along with this, there are two sponsored seats in each of these colleges. So this is the usual seat matrix. And this year, there were some changes in the seat matrix. And in NIMHANS, again, there were two. But PGI has actually removed the UR seats and they kept it on sponsored category, in the sponsored category only. So this happens sometimes, and we actually don't know the reason why the seats gets reduced or changed. But again, next year, I think there will again be 4 seats. And since there was this thing, yeah, so there were just 2 seats in NIMHANS, and no seats were given from in UR category in VGI this time. So this is how the matrix is actually. So let's hope if it is again 4 seats, then it's good, and that's how it is. It's like, yeah, mostly.
Okay, fine. So
So I think it's time to wrap up for today. I'll see you guys very soon, and I'm so glad that you guys joined. It was so wonderful having all of you. And yeah, I'll see you guys soon. And I think we are going to really have a lot of fun, right? And we'll learn together, we'll grow together, and we will see each other in person also very soon. And I'm really hoping that we'll have so much fun in this course. And till then, I would just say to all of you that, a topper is not a person, it is a mindset. So if you have that mindset, you can definitely go to the top. And I'll always ensure that that mindset is with you. And don't give up ever in life, because you will get to what you want. Okay. And I think that's all for today. I'm so happy that you all were here, and so privileged that I was here with you. And yeah, I'll see you soon. Bye. Take care. Good night. And if you all have any queries, you can also DM me, answer, and we can also like start to clear off your doubts in the group and everything. And yeah, thank you. Bye.